HIV affects by reducing the CD4 cell count and get opportunistic infections of the eyes mostly, but there can be HIV retinopathy. That doesn't cause loss of vision. This can have anterior segment lesion. That is less common, but most common is the posterior was posterior segment lesion, cytomegalovirus retinitis. But now with the with the advent of all new ART drugs, that posterior segment lesions has markedly reduced. But we see the tuberculosis lesion of the eye, the small choroidal nodules in the eye. We also see immune recovery uveitis, immune recovery changes in the eye, and also the new drugs producing some kind of side effects which we still do not know. Some of them produce dry eye, that irritations of the eyes and some kind of a color vision defect or a small subtle defect in the retina. So we are doing a study on that. Some of the kind of OCT and optical coherence tomography of the retina, small retinal changes which can occur inside the eye. ERG also we are doing that one. We go to the YRG care center and see all age patients, particularly who are admitted.
Yes.
And any patients with ocular complaints which we see.
Ocular complaints means eye complaints.
Eye complaints. Yes. So the dimness of vision, dryness and all these things. We also see some children of mother to child transmission which has occurred. These children has grown up, and if they are not receiving ART, they develop some eye complications.
Okay.
So
yeah.
4.8% of HIV patients had ocular tuberculosis. They can have nodules in the eye, choroidal nodules in the back part of the eye. They can develop subretinal abscess in the eye. They can also develop choroidal tuberculum of the choroid, some kind of a large choroidal mass lesion in the eye. So,
and is it difficult to diagnose?
No, it's not difficult to diagnose. Yeah. If you dilate the eyes and you see with indirect ophthalmoscope, we can see the changes inside the eye.
Yeah. But routinely does physicians think about, HIV physicians think of ocular TB?
No, they do not think about ocular TB. Ocular toxoplasmosis also is another common feature. This toxoplasmosis is difficult for diagnosis for even ophthalmologists because they are very extensive and they are multifocal. Usually the toxoplasma in the eye in normal people, immunocompetent people, is single focus. It is a multiple focus lesions and is very large. We have recently seen one lady who had a blood transfusions several years back, had developed a kind of retinitis, so extensive retinitis, we thought that is a viral infection. Later on we found that this is due to the toxoplasma, and patient responded well to the toxoplasma treatment.
Okay. So late diagnosis of ocular TB in people living with HIV is a reality.
Yeah, can cause vision loss.
Yeah, it can also cause vision loss, right?
Yeah, it can cause vision.
So what can be done so that people living with HIV with ocular problems?
So they should send any ocular problem, any eye problem in the patients, even if the CD4 count is high, should be sent to an ophthalmologist. And who should see not only the front part of the eye, back part of the eye also should be seen. So there may be some lesions, is that one. I published an article of ocular lesions in AIDS in India, a book, small book, which has been published by from Madras. And it is widely circulated. It has been given free to all medical colleges.
Okay. And the diagnosis is made, like, do you take samples of the eye? Like, I'm just imagining how it happens.
Yeah.
It goes to gene expert.
Sometimes we make a clinical diagnosis. Sometimes we do imaging But many of the times we take a small fluid from the anterior chamber eye of the eye, that's the front part of the eye, by taking a fluid from the eye we call aqueous humor. We do it, and we do that molecular biologic study and as well as the microbiologic study. You heard of PCR?
Yes, yes.
Polymerase chain
Yes.
reaction?
Yeah.
So we have done polymerase chain reaction for many of the HIV
That's LP.
cases.
Is it called LPA? Is it part of the
No,
line probe
it's,
assay? No, that's a different PCR.
It's a different PCR.
Okay, all right.
It's called real-time PCR or nested PCR.
Okay, right. Okay. And about the treatment of ocular TB, is it?
It is the standard treatment we
standard.
should give. That whatever the normal treatment we give for the TB, that works for the ocular TB also.
Right. So when a patient is diagnosed of ocular tuberculosis, so or she is referred to the HIV, TB clinic. right?
TB
Dots
TB
clinic.
doctor.
Yeah.
TB specialist takes care of that one, and we
Right.
see that regularly. We review the patients and check the eyes.
Yeah. So,
They
right.
respond to very well to the anti-TB treatment.
Yeah.
AIDS doctors should look into the new infections and also the drug-related problem in the eye. And particularly newer drugs has come, and many of them they do not know that what are these complications or what are the side effects. Many of them can produce color defect, color vision defect, or dry eyes, or some other problems. So we need to investigate them, and particularly all the patients should be seen by an ophthalmologist if they develop some ocular complaints.
Right.
This is the message which should go.
Yeah.
So
Right.
that AIDS disease, though has declined, but still we have got a long way to go. We need to see that many other infections and inflammations and diseases in the eye. Eye is an organ which, if it is lost, the vision is lost, the patient is an economic burden to the family and the society.